Am I pregnant? Am I pregnant? Am I pargant? Am I gregnant? Am I pegnate? Help? Is there a possibility that I'm pegrant? Am I pregnant or am I okay? Could I be pregonate? How do I know if I'm prengan? Can I be pregnant? Can u get pregante?
I'm pregnant.
Whoa! Congrats! A little clone of you! That's so awesome!
It doesn't feel awesome. It feels scary. And I have these nightmares where I'm in the delivery and the baby is a bowl of salsa. I'm not sure if I could take care of a baby that's a bowl of salsa. What if I drop him or people try to eat him?
I'm hearing that this is an overwhelming moment for you.
I've been going to therapy, but I feel like I need something more.
Tell me more about that.
I honestly think I need some sort of medication, but I don't know where to start. I don't want to harm my kid or myself, which then harms my kid. Ugh, I don't know.
Hey, choosing to take medication for our mental health is a difficult decision, especially when you have two people to worry about. If you'd like, we can make a visit to Psychopharmville.
Psychopharmville?
Wait, wrong place. Here we are! This place produces and studies the use of psychotropics, which is just a fancy word for medications used to change what goes on in your brain. Oh, look, that's the mayor of Psychopharmville! Hi, Mayor!
Hello again. I see you've brought a friend this time.
Yep, and she's preggers. I brought her here to learn more about how psychotropics work for people who are carrying little people inside of their stomachs.
Oh, well, I'm happy to have you both here. To be frank with you, we don't know as much as we should about how our brain meds affect those with babies growing inside of them.
That's crazy, because there's about 140 million babies born every year. That's a lot of pregnancies, and pregnancy isn't easy. Along with changes on the outside, pregnant folks also undergo significant changes on the inside.
Yes, their brains change a whole lot, and sometimes not in a good way. Of all pregnant women, 7 out of 10 will complain of depressive symptoms during pregnancy, and around 20% will experience anxiety or mood disorders during pregnancy.
Oh, so I'm not crazy.
It's normal for mental illness to be exacerbated by pregnancy. Still, we don't have an exact formula for how to treat mental illness during pregnancy with medication.
That's because every person is unique.
Right. So the decision to take medication while pregnant will depend on what the pregnant person needs and the child needs, because the drugs will affect them both.
And there's risks for treating mental health and not treating mental health during pregnancy.
From assessment to treatment planning, counselors and psychiatrists can support pregnant clients as they decide to treat their mental health with psychotropic medication. Anyways, this conversation is making me nervous, and I'm gonna go eat a burrito. Enjoy your stay, peeps.
Thanks, dude.
I feel just as nervous as that guy.
It's okay to feel nervous. This decision is important, and you want your baby and yourself to be healthy. Here, let's find the key things we would need to know about the relationship between Psychopharm and pregnant peeps, starting with diagnosis.
That's like when you get a fancy name by doctors for what's making you sick, right?
Yeah, in this case, it would be the name for the symptoms a pregnant person is experiencing. The most common mental health diagnoses in pregnancy are depression and anxiety.
I have both. How convenient.
Diagnosis during pregnancy can be extremely challenging, mostly because symptoms of mental illness in pregnancy look very similar. For example, broken sleep, lack of energy. Both are common in pregnancy and depression. So are crying spells, changes in appetite, irritability. You get the idea.
So how do we tell the difference between normal pregnancy and mental illness?
We have to pay attention to the thoughts of the pregnant person. Mental illness during pregnancy can look like anxious or negative thoughts about the pregnancy or the baby, difficulty with shape and weight changes, especially if the person had an eating disorder in the past, pessimism, and thoughts of worthlessness. This list is just to give you an idea, as the difficulties one has with their mental health during pregnancy can look unique.
Okay, so when should we be looking for these symptoms?
Typically, psychological disorders during pregnancy can be more apparent in the second trimester, but it's important for pregnant people who have had mental health disorders or are susceptible to them to get regular checkups for their mental health during and after their pregnancy. We just really have to pay attention to the psychiatric history of our pregnant patients.
Okay, so mental health diagnosis is difficult, but important to pay attention to.
Right! And because it's difficult, there are specific assessments to make it easier to diagnose pregnant folk. One example is the Edinburgh Postnatal Depression Scale, or EPSDIS for short, EPDS. It's translated into 50 different languages, with 10 self-reported questions, and takes less than 5 minutes to complete. Here you go. The assessment includes anxiety symptoms, and excludes symptoms of depression that are common during pregnancy, like changes in sleeping patterns and stuff. Thanks, little dude. There's also the Postpartum Depression Screening Scale, the Patient Health Questionnaire 9, the Beck Depression Inventories, whatever test is used. We need to remember that any results need to be interpreted within the context of the client. For example, a tearful client with a flat affect and a normal score does not exclude depression, and a high score in the context of stressful events may resolve with a follow-up.
Is there an assessment that can tell me whether or not I should take psychotropics during my pregnancy?
There is not yet, but there are assessments to provide structure to comparing new prescriptions to current medications. The SHIM, the Sexual Health Inventory for Men? No, lowercase I, the SHIM, the Structured History Taking of Medication Use Questionnaire. Never mind. Just know that any mental health screening for pregnant patients has significant clinical benefits. I'm out.
This is all good to know. I still don't know about the risk. I'm still worried about it hurting my baby.
It's time we look at risks. We'll compare the risk of untreated mental illness during pregnancy and the risk of treatment with psychotropics during pregnancy. Sometimes the risk of not medicating a patient with psychosis, mania, or severe depression are more severe than the potential risk associated with the medications. Untreated mental illness during pregnancy and after can result in negative physical and psychosocial changes. Physically, untreated mental illness can result in low baby weight, premature birth, childbirth complications, malnutrition, diminished life quality for baby and parent, and loss of bodily function for baby or the parent. When we're looking at psychosocial effects, untreated mental illness during pregnancy can result in substance abuse, self-harm, and even suicide.
I never realized how dangerous it could be to not take care of my mental health during this time.
Yeah, even seeking treatment with psychotropics can also be dangerous. While the medications can help pregnant people emotionally, they can also potentially cause malformation of the fetus, effects on the growth and development of the fetus, effects on labor and delivery, effects on the baby after they're born, behavioral complications in the baby, and transmission of medication through breast milk. The greatest risk is malformation of the fetus, specifically during the first trimester. During this time, the babies forming their first little organs.
That's a longer list than I expected. So all psychotropics do this to pregnant people?
I don't know. Let's ask that guy. Hey, yo, which ones are safe for pregnant people? Oh, hello. To be honest,
That seems to be the answer for everything here. Do you guys just not like pregnant people?
No, it's just hard to study pregnant people because we don't want them or their babies to get hurt. But you could learn more about that from Ethics Ethel over there. Oh, we'll visit her later. But tell us more about what we can give to pregnant people carrying the babies. Well, what we do know is SSRIs seem to be the safest option out of them all. They don't seem to be correlated with fetus malformation. Side effects can include your typical sleepiness, anxiety, nausea, heartburn, dry mouth.
I had all of those this morning.
Side effects can also happen in the baby. There's potential for the baby's brain functions to slow down from SSRI use. The fancy name for that is central nervous system depression, which we usually see in patients who overdose on certain substances. Yup, SSRIs may also make it difficult for the baby to completely empty their bladder. SSRIs, if not properly monitored, can make too much serotonin for the baby. The dosage may be right for the pregnant person, but way too high for the developing baby.
You can have too much serotonin?
Oh yeah, just like water or sprinkles. There's also other med options for pregnant people, but they carry more risk. Lithium can be used only with dosage adjustments, reductions, and special attention to how the fetus is growing. If it's used during the first trimester, there's a high risk for fetal malformation. Lithium can also cause significant heart abnormalities, decreased muscle tone, poor circulation, and lethargy in the infant.
Those are a lot of scary words.
Yes, that's why there's even alternatives to lithium, like antipsychotics, carbamazepine, and clozapam. And even those still carry the risk for fetal malformation and are found in breast milk. Do anticonvulsants and benzodiazepines also result in fetal malformation? Most of the time, yeah. Again, it's just hard to tell when most of these medications have not been studied on pregnant humans. At this point, safety isn't really completely clear for any of them.
That's what I expected.
These risks can also be called contraindications, and that's a fancy word for harmful reasons why you shouldn't take a drug.
The effects on the baby's growth, instant and long-term effects on the baby, breastfeeding effects, and a baby withdrawing or overdosing from the womb? It's so stressful.
Just as stressful as taking care of a baby who is a bowl of salsa. Hi, I am a counselor who specializes in the mental health of pregnant clients.
Oh, hello there! I am a big fan of therapists.
I'm so frustrated because I don't think my counselor is trained in working with pregnant people, and I'm not sure if medication is right for me. Ugh!
It makes sense to feel overwhelmed. Even professionals are still figuring it all out. In an ideal world, all counselors would receive training to provide mental health counseling to pregnant individuals. It's possible for a counselor to receive credentials or certifications, specifically for counseling pregnant clients.
That's cool. In America, I know education can cost lots of money, and I'm broke. Let's say a certain class of really smart, but sometimes broke, beginning counselors were watching. What would you want them to know about counseling pregnant folks?
First, counselors need to be aware of those warning signs and risk factors of mental health issues during pregnancy. The warning signs of mental health problems during pregnancy can look like negative or anxious thoughts about the baby, pessimism and thoughts of worthlessness, loss of interest in once pleasurable activities, self-harm, suicidal ideation, or thoughts of hurting others. The factors that may put pregnant people at risk for mental health issues include a personal or family history of mood disorders or related mental health conditions like depression, anxiety, PTSD, and others. Previous complications from past pregnancies, a major life event, having multiple children, lack of support from family or friends, lack of financial resources.
So counselors need to be aware of what mental health issues during pregnancy look like and what could make them more likely to have a mental health issue during this time.
Counselors also need to use appropriate referral services with the client. In coordinating care between medical providers, counselors can advocate for their client if medication seems to be a viable form of treatment.
My therapist hasn't given me resources yet, and I sort of found out about medications from Google. But I'd like to see my options for treatment and talk through my decision.
To help clients make an informed decision about medication use, clinicians need to collaborate with their patients on a treatment plan, inform them of the risk of untreated mental illness, and psychoeducate clients about the realities of using psychotropics during pregnancy.
Psychoeducation?
Psychoeducation! It's like knowledge that specifically helps you treat your mental health disorders and make informed decisions about treatment.
And we need psychoeducation in this area because treatment with medication is often resisted by pregnant clients. The dangers of untreated mental health disorders are typically underestimated, while the risk of these medications are overestimated.
While I do think they are risky, I can also see how they would be really helpful. It's weird.
It's ambivalence. I'm back. While even experts don't know everything about psychotropics during pregnancy, it's also important to tell clients that SSRIs do not cause fetal malformation, and to know that studies support a combination of traditional talk therapy and psychotropic medication for pregnant people who are suffering from severe mental health disorders. If the pregnant client is open to medication as part of their treatment, I've heard that it's helpful to make a personalized list with them of the risk and the benefits for using psychotropics.
That's helpful. One online resource has up-to-date, evidence-based fact sheets about the risk of using certain drugs during and after pregnancy. And they have a Spanish version available.
Me encanta.
If the client is still hesitant to take psychotropics, it is important to help them find treatment they are comfortable with. Postpartum Support International maintains support groups, resources, and hotlines. In these online support spaces, pregnant individuals can feel less alone or develop a support group outside of their immediate circle.
That sounds like a great option, especially for those who feel isolated during their pregnancy.
One last big thing that I am really passionate about is advocacy during pregnancy, specifically for integrated care systems. It's when medical professionals and organizations partner up. These partnerships put all of the resources in the same building, or they use a network of referrals.
So where do counselors fit in?
Counselors can advocate for this type of programs to be adopted in their area. If implemented, practitioners can refer their clients to the resources these programs provide, or providers can receive training from the programs to better care for pregnant clients.
Even though I'm not a counselor, it has been helpful to get this perspective. I had no idea how helpful counselors can be in the process of choosing psychotropic meds.
It was nice meeting you, and good luck on your journey.
Thanks.
How do they know any of this will work for every single pregnant person?
Well, they can't possibly know because every person is so different. That's where culture comes into play. Let's go see how the multicultural crops are coming in.
Hello there. It's nice to see some new faces.
Ah, I see there's a new leader of the cult crops. I wonder what happened to the old one.
The old one vanished after getting canceled on Twitter. Anyways, what brings you both here?
I'm wondering, what role does culture play in pregnant people taking psychotropics?
We don't know much about the intersection of pregnancy, psychotropics, and the various layers of culture. The pool of studies in that area is quite small already.
Darn.
What I can tell you is that we know how certain aspects of culture can affect pregnancy, which could lead to some hypothetical situations in treating the mental health of pregnant folks.
If you were to specifically think of three, what would they be?
The main ones I can think of are spirituality, ethnic identification, and environment.
Spirituality can play a large role in what someone does, says, and believes. Spirituality during pregnancy is no different.
Right. Some cultures prefer to not tell others about their pregnancy to ward off bad luck or evil spirits. This practice could potentially make a pregnant person feel lonely or even feel unsupported by their loved ones. It may not be easy for a person to share their pregnancy with anyone, including health professionals.
So it'd be important for mental health counselors to respect the privacy of pregnant clients, building their support systems without having to engage in the topic of pregnancy.
Another example of spirituality affecting pregnancy can be seen in some branches of the Christian religion. Sexual purity before marriage can be a value upheld within said community, dictating when someone becomes pregnant. If a pregnant person in the community chose not to uphold this value, they may feel a strong sense of shame or guilt about their pregnancy.
That sounds so lonely, and like it might cause mental health issues for the pregnant person, but they might not see it that way.
And that's just one example of how culture can impact treatment of mental health. That's why it's very important to pay attention to the way culture impacts the pregnant client when screening them for mental health concerns.
Yep. It has also been found that individuals identifying with cultures who have experienced long-term mass trauma show higher prevalence of disease, higher rates of mental health concerns, and poor health during pregnancy.
That actually makes sense, because even famine could have an effect on the genes passed down from generation to generation. It's no wonder the environment of pregnant people can affect their mental health.
High rates of poverty can cause depression, anxiety, or stress, which are things you don't want while pregnant. Being the sole provider in the household can exacerbate this stress.
I see now why it would be so important to advocate for resources for pregnant people and to consistently monitor how they are doing mentally.
Also, having a conversation about culture with your counselor seems like it may be helpful in figuring out a culturally sensitive treatment plan.
Yes, do better than our last leader and just delete all of your social media while you have the chance.
All this walking and learning is making me hungry.
I know just the place we can go. Hello? Ethel, are you there?
Well, howdy, stranger. It's been a while, hasn't it?
Oh, yes, it has. And my friend has a bun in the oven. Speaking of ovens, can you tell us more about how ethics plays a role in counselors treating pregnant people with psychotropics, preferably over cookies?
Yes, of course.
Why are we here?
You
I'm
can't
not even a
forget the
counselor.
We need to help the hypothetical classroom understand everything about psychopharmacology and pregnancy. But also, I just really want the cookies, so don't blow this for me.
Thanks for the cookies, Ethel. I'm afraid to ask this, but what are ethics?
Ethics are an attempt to define what is good for the individual or society. In counseling, there are a set of rules for counselors to follow to ensure that clients are receiving the proper care they deserve. Like recipes, there's even ingredients to a counselor's code of ethics: autonomy, non-maleficence, beneficence, justice, fidelity, veracity. Of course, when treating any patient, all of these values are involved in making sure the client is getting the best treatment. Let's say you're a therapist and your client comes to you with the same decision you're faced with. Which of these guiding principles do you see have an effect on how you treat your patient?
Well, autonomy. I'd want to make sure the pregnant client has the decision to choose what treatment they feel is best for them. I can also see non-malfeasance, as I wouldn't want to cause the parent or child in the situation harm. I'd also want to promote the well-being of both the parent and child. Beneficence. With justice, I'd also want to treat them fairly. I'd also want to fulfill my professional duties. That's fidelity. I'd want to be truthful with the client, especially when explaining the risks of psychotropics.
Look at you being a little therapist. I'll have to take you to see the pillars of the ACA sometime.
Treating mental health issues with this population can cause numerous ethical dilemmas for the patient and the counselor. There are also some common ethical considerations, which are conflicts between interest of the mother and developing fetus or child, conflicts between patient and spouse or significant partner, threats or forced decisions by members in the family system, ethical obligation to protect children of patients, limited information to guide decision making, and ambiguity of risk. Just know the most ethical decision for counselors to make is to discuss the risks and benefits of psychotropic medications for pregnant people and let clients make their own decisions. Even after the client's decision is made, the counselor needs to revisit the client's decision and assess how well it's working for them or helping them achieve their treatment goals.
Wow, I never thought of it like that, Ethel.
Well, that's why I'm here. And just like counselors, I even need to be up to date in the knowledge about how psychotropics affects pregnant people. Oh, and biases. We also need to be aware of our personal biases. Whether we are in support of psychotropics or not, we can't let our value system completely influence a client's.
So it sounds like overall, Psychopharmville and counselors have the moral duty to give pregnant clients the information they need in order to make an informed decision about using psychotropics in their treatment.
Yes. Thanks for visiting. I'll have to ask you to go cause I'm late for my nap.
No worries. Thank you, Ethics Ethel. She's so nice. And did you just steal a whole plate of cookies?
Sorry, I know it's not ethical to do that, but I'm just so hungry. Enough cookie time. We have one more stop to make.
Sorry, I meant salutations.
Hi, Madame Loiteress. It's an honor to speak with you. I have an obligation to a hypothetical classroom, and I need to know what are some legal considerations for counselors treating pregnant patients, specifically with psychotropics.
Are you getting sued by this individual?
No?
Not yet.
Never mind, I don't care. In most places, the law requires counselors to ensure that pregnant clients can make informed decisions about their care. A person's decision-making ability can be affected by mental illness. Therefore, it is really important for counselors to teach clients about psychotropics in a way that is understandable and factual. Studies have shown that liability concerns often impact counselors' decision-making when it comes to pregnant people and psychotropics. These concerns over liability can also impact a psychiatrist's decision, even for those who have been practicing for a very long time.
Makes sense. I can't think of anyone who wants legal trouble.
She does. That's How she makes money?
Ahem. Over half of psychiatrists will consult outside resources to assist with their decision to give psychotropics to pregnant people. One finding that is odd is how providers are less likely to screen patients because they know what depression looks like.
Even if we're familiar with depression, it's important to at least screen pregnant patients for depression because of how common it is during pregnancy.
And when you do screen pregnant people, it's important to document. One last but crucial piece to remember is counselors also have a duty to protect, meaning they need to protect patients and others from violence. And newborns are no exception from the duty to protect. If any client expresses hurting a baby, it's a counselor's duty to protect that baby. Counselors might encounter this in very severe cases of postpartum depression.
What can counselors do to protect clients or prevent a violent situation?
To reduce the risk of harm and illegal battle, counselors can read more about the duty to protect, taking continuing education on topics like violence assessment and risk management, consulting with expert colleagues or attorneys about patients who concern you and documenting that, and staying up to date on laws in your state.
Thanks for the info. I'm not a counselor, but it's helpful to know how counselors protect their clients and those around them.
One last question. May I touch the gavel?
Please, leave.
So, how are you liking Psychopharmville?
This place is weird.
Yeah.
I mean, informative.
Tell me about some of the things you've learned while here.
I learned that it's common to have depressive symptoms during pregnancy. The safest option for pregnant people taking medications is SSRIs. Counselors can help me and other pregnant folks by teaching the risks and the benefits of psychotropics. They also have an ethical duty to let the clients make their own informed decisions. Culture can impact these decisions about treatment and the mental well-being of the client themselves. And the last thing I learned is that counselors are liable for keeping people and babies safe and ensuring clients get the care they deserve.
Nice summary. I guess it's time for you to make that informed decision now.
I'm assuming the hypothetical classroom can help me make this decision.
Yes, of course. Now introduce yourself to them.
My name is Flo. I'm 27 years old. I live in a tiny Californian apartment in Hercules. The rent is expensive, but I manage with a decent job in engineering. My social security number is none of your business. I have a partner, but I live alone. I don't really have a relationship with any of my family members. I have some good, but kind of weird friends.
If you feel comfortable, can you tell me what kind of mental health symptoms have you been experiencing?
Before finding out I was pregnant, I was already struggling with loss of interest in pretty much everything. It was always hard to concentrate because I could barely get any sleep. I still feel tired all the time. Sometimes I feel guilty and worried about the pregnancy, and it's hard to control both. I'm also just irritated, but mostly at myself for everything that has led me to this point in my life. At times, I feel hopeless because I'm not sure if I'll be able to survive on pregnancy leave by myself. One of my old coping mechanisms was suicidal ideation. I'm just worried it will come back with everything that's going on right now. I'm considering psychotropics because I just feel like I'm at my limit. So yeah, hypothetical classroom, what would your treatment plan for me look like?
It's your turn, hypothetical classroom. We're getting meta in here.